Hey YouTube, I'm Matthew Tonthat. I'm a practicing urologist and I made this YouTube channel to share real insights about health and our broken healthcare system. My goal is to help you take control of your own health because I think you already know that you cannot really rely on our healthcare system to care for your health. Many men are referred to me for erectile dysfunction. That's problems getting it up. So let's say a guy comes to see me for the initial consultation because he can't get it up. I could just write him a prescription and call it a day. And most days, that is what I do. I write for Viagra, also known as sildenafil, maybe Cialis, also known as tadalafil. I send him on his way. I'll see you back in 3 months, see how it's working. But here's what I'm really thinking about when that guy walks into my office. There's an old saying, canary in the coal mine, and it reflects how I see this patient. Now, back in the day, coal miners would bring canaries down into the mines with them, and canaries are more sensitive to toxic gases than humans. So if the air in the mines became dangerous with carbon monoxide or other poisonous gases, the canary would get sick or die first, giving the miners an early warning to get out before they were affected. So if the air was safe, the canaries would be flying around singing. If the air became toxic, the canaries start to fall. No more singing. That is the signal that what we're doing, which is mining coal in this enclosed space with high levels of toxic gas, is not safe for health. So now we have to change something. So let's get out of the coal mine with the toxic gases. So in this saying, the canary in the coal mine, the canary dying is not the problem. The canary dying is the warning that something much bigger and more dangerous is going to happen unless we change something. Now, in medicine, the parallel here is your penis, your erections, your erectile dysfunction is the canary for your cardiovascular system, your circulation of blood. The loss of your erection is the canary that dies first. And here's why. Getting an erection requires really good blood flow through tiny, delicate blood vessels in the penis. And when your circulation starts to decline, the penis is one of the first organs to show symptoms, and that's because erections are so dependent on healthy blood flow. So all these many tiny arteries in the penis dilate or relax when we get erections so that they can fill up with blood. So if your circulation's not on point, this process, which is very complex in terms of nerves and circulation and vasculature, it's the first to go. These are some of the smallest functional blood vessels in the body that need to work in perfect coordination to make the erections happen and to make the erections go away. As your circulatory health worsens, the ability of your pump, which is your heart, to get blood to the parts of your body further away, like the penis, it's essentially a hydraulic pressure problem. The furthest and the smallest vessels get compromised first. And that's why erectile dysfunction often shows up 3 to 5 years before heart attacks or strokes, because the penis is the canary. The penis is the canary because it needs perfect circulation to work, just like the canary needs really clean air to live, and it's the first to fail when your cardiovascular system starts declining, just like the canary is the first to fall when toxic levels in the coal mine start to rise. So we have two choices, just like the miners, the coal miners, when they started to see the canaries falling. If we're in the coal mines, we see the canary die, and we change something. We get out of the coal mine to prevent carbon monoxide poisoning of the miners. Or we could just keep working, business as usual, and end up on the ground with the canaries. Now, the loss of erections is the canary. And in this coal mine of your health, we could see that the loss of erections is a sign that your cardiovascular system is unhealthy, and that's a sign to change something, to improve your circulation. Or we could just keep on keeping on with business as usual and end up with progressive cardiovascular disease, which will continue to wreak havoc on other organ systems and your overall health. It can lead to heart attacks, strokes, kidney disease, increased risk of cancer, increased susceptibility to infections of all kinds. And these are all downstream effects of poor circulation. The quality of your circulation affects everything. And the metaphor I like to use is kind of like a car's oil, a vehicle's oil. When the oil is clean, if the oil flows smoothly to all parts of the car engine and everything's lubricated. But when it gets dirty and thick, what happens is it can't reach the small spaces in the engine. It starts to damage parts it's supposed to protect. And your engine runs rough, it loses power, it eventually breaks down. Your blood is like that oil. When your circulation is good, it's clean blood flowing smoothly. It delivers oxygen and nutrients to every organ perfectly. But when your blood gets thick with sugar and fat, when your arteries get narrow and stiff and have a high pressure, blood pressure, it's like running dirty oil through your engine. In our vascular circulation, the main variables I see causing problems are cholesterol, sugar, blood pressure. The cholesterol and sugar result in that dirty, grimy, thick oil that can't lubricate your moving parts. This leads to damaged engine components, which are your organs, and expensive breakdowns, which are cardiovascular events, hospitalizations, and cancer. The high blood pressure is like a high oil pressure in your car. Now your pump has to push harder. Your heart has to pump harder to keep your organs functioning, to get blood going everywhere. And just like your car's engine working overtime to push thick oil through clogged passages, something will eventually give. Maybe your heart's working so hard, it's not getting enough oxygen itself. And then part of the heart is not getting enough oxygen. That's when it starts to hurt. That's when you get chest pain. And if that ischemia, which is an insufficient oxygen delivery to the heart, goes on too long, then that part of the heart stops working permanently. And that's what we call a myocardial infarction, also known as a heart attack. Maybe a gunky plaque breaks off from an artery feeding the brain and lodges somewhere smaller. And it blocks oxygenated blood from getting to that part of the brain for some amount of time. And then maybe you lose function of that part of the brain. Maybe you can't talk, maybe you can't move one side of your body. This is what we call a stroke. So what if you don't get a heart attack, you don't get a stroke? Your circulation is just kind of gunky, you're not able to deliver the best nutrients to your body, get the wastes out of those organs. So nothing in your body is going to run as smoothly, even if you're not having heart attacks or strokes. And one of the things that can go awry is your body's maintenance and construction crew. Our body is always turning over. Our cells are constantly dying, sloughing and falling off, and then new cells are made. And it's a controlled death, though. It's a controlled process, like a renovation. It's a very regulated machine. And if it's not running smoothly, one thing that happens is we start making things, overproducing cells, even past the usual point where we have enough. So a certain cell type is rapidly replicating and dividing and growing with no end in sight. It starts at a cellular level, which we cannot see, but without a smoothly functioning system, it doesn't know when to stop. So it keeps on multiplying and growing and replicating indefinitely. And then when enough growth has occurred, you can see or feel a nodule or a tumor. And this cell type may not even stay where it's supposed to. It can outgrow where it started from and spread elsewhere. And this is what we call cancer. And how I conceptualize and see cancer, it's growth without intention, without consideration, just pure growth for growth's sake, because we want to grow, because we want more, because we want to spread. Cancer will literally outgrow its own blood supply. And this problem, metaphorically, sounds kind of familiar, huh? Let's go back to our example, our dude who can't get it up. Here's how we handle this in medicine. I'm a urologist. Patients are referred to me for erectile dysfunction. I'm a physician and surgeon of the urinary tract and the male genitals, which includes the penis. So the referral was appropriate. I'm not a primary care physician though, so blood pressure and cholesterol treatment, that's not my thing. I'm not a cardiologist, so cardiovascular health is not my thing. I'm not an endocrinologist, so I'm not trying to mess with your insulin regimen. So I prescribe Viagra. Maybe I even say something in passing like, this could be a sign of early heart disease. And I ask you to go see your primary care doctor to talk about your high blood pressure or your cholesterol. And then your primary care doctor will prescribe you a calcium channel blocker for your hypertension and a statin for your hyperlipidemia, your high cholesterol. I recommend you go to your endocrinologist to talk about better blood sugar control. And maybe they'll increase or change your insulin regimen. So I took care of my thing. Primary care took care of their thing. Endocrinology took care of their thing. And now you have 3 new medications and a higher insulin dosage. But none of us are really addressing why your circulation is failing in the first place. What if instead of adding 3 more medications, we actually listen to the canary? This is the hard part, and that's why most people don't do it. That's why I don't prescribe it, because I can't write a prescription for fix your circulation. There's no pill for discipline. There's no injection for consistency. There's no surgery to implant healthy habits in you. But here's what listening to the canary actually looks like. It's very basic. It's eating foods that don't thicken your blood with sugar and fats. It's moving your body regularly to keep your circulation strong. It's getting quality sleep so your body can repair itself. It's managing stress that increases inflammation and damages your blood vessels. And none of this is sexy. It's not quick. Does not come in a bottle. I can't prescribe it. And that's exactly why the medical system doesn't push it, because there's no revenue model for eat better and move more. But your canary is trying to save your life. The question is, are you going to listen? Are we going to listen? We'll see.